Hi, welcome. Thanks so much for joining us. We're going to give people a few minutes to join, so please settle in. My name is Meg Davis from the Geneva Graduate Institute. And as you're joining, we'd really appreciate it if you could please use the chat box to introduce yourself and say a word about where you are calling in from. And we'll get started in just a sec when a few more colleagues have joined. Thanks. We're also curious to hear if you use your mobile phone to look for health information. We're curious where you go, whether it's looking on a web platform, whether you text a friend, whether you look at a social media platform. Just kind of curious where people look for their health information online. So as you introduce yourself in the chat box, let us know if there's a preferred app, preferred site you go to for health information. I'm going to say that I, like a lot of people, I use Google a lot. But I also tend to look for sites that I think probably have some scientific basis. But then it depends really on the issue. So sometimes I'll look at different kinds of sites. Great to see a lot of our colleagues joining from different organizations. Okay, so while more people are joining us, we're just going to get started because we have a really packed agenda and lots of exciting speakers to hear from today. So please keep introducing yourself in the chat box and telling us where you're coming from. My name is Sarah, also known as Meg Davis. I'm principal investigator of the Digital Health and Rights Project, and also senior researcher at the Global Health Center here in the Graduate Institute in Geneva. Thank you so much for joining and making time for our conversation today. Special thank you to our co-organizers, the Global Health Center, the Digital Health and Rights Project, the Global Network of People Living with HIV, the International Geneva Platform, Privacy International, Restless Development, and Stop AIDS, and also Caribou, and welcome to those who are joining us on Love Matters Kenya's site on Facebook. We are really excited to share with you the results of 18 months of research in Ghana, Kenya, and Vietnam, and some initial learnings from Bangladesh and Colombia, where research is just getting started. And to introduce you to a few of the wonderful researchers and advocates it's been a privilege to work with during the past 18 months, who will talk about the research and their recommendations. And also, we have with us today a few of the innovators that we have found in our research from Ghana, Kenya, and Vietnam, people who are using mobile hotlines and social media to reach young people in their diversity with health information and support. We're going to discuss the implications, which we hope will be insightful, inspiring, thought-provoking, maybe even empowering. And also talk through the policy recommendations that we've developed with our colleagues at Stop AIDS and a member of our advisory committee from the World Health Organization. A few logistics, please use the chat. We think networking is really important and we can't all meet in person. So please use the chat to network, contact each other, share your thoughts, exchange information and links. Of course, keep it civil. You're welcome to disagree with us if you like, but please keep it respectful. Post any questions you have in the Q&A, and we'll respond to these as much as we can. And if you're on Twitter or the Fediverse, please use the hashtag Digital Health Rights, which my colleague Isla has just posted in the chat. You can see we have a big agenda, so these are the welcome remarks from me. I'm going to present the research findings with my colleague Namtika Mjwana from the Global Network of People Living with HIV. We'll hear a short presentation from Professor Catalina Gonzalez Uribe from Universidad de los Andes in Colombia. We'll have a short video for you from Vietnam, and then we'll have a roundtable discussion led by Tigis Tamrat at the World Health Organization with Stephen Agbenyo from Savannah Signatures, Tabitha Ha from Stop AIDS, Terry Gachet from Love Matters Kenya, Catalina and Tika and I will also stick around to join the conversation. And finally, we'll take some questions as much as we can. So thanks very much. With that, maybe we'll move over to the first presentation for our session. And I think Namtika has some slides to share. So while she's getting that started, I want to introduce Tika. For those who don't know her, she is a force to reckon with, a great thinker and writer and activist and researcher, a health advocacy and communications expert and project manager for the digital health rights work at the Global Network of People Living with HIV. She's based in South Africa. So we're going to go through quickly some slides together. So on the next slide, just want to tell you about our consortium, the Digital Health and Rights Project. We are a very diverse group. It's a unique collaboration for research, education, and policy action. And we include social scientists from the Graduate Institute in Geneva, from Brock University in Bangladesh, and Universidad de los Andes in Colombia, civil society networks and human rights lawyers, including Kaylin in Kenya and Stop AIDS in the UK. We've recently also been joined by Privacy International and Restless Development. We also are joined by the Global Network of People Living with HIV and 2 national networks of people living with HIV in Ghana and Vietnam. And we benefit from expert advice from an international project advisory committee, you can see listed here, who include the UN Special Rapporteur on the Right to Health, Dr. Tlaling, other experts, scholars, 2 youth activists, and Tigis Tamrat, who you'll meet later on in this session. On the next slide, the global context for our study is really this very rapid rise of the digital transformation in health, which was of course accelerated by the COVID pandemic. Global health and national health agencies are really embracing this trend. In 2021, the World Health Organization launched a global strategy on digital health, which called on countries to strengthen health systems with digital technologies and data. And other global health agencies, including the Global Fund to Fight AIDS, TB, and Malaria, and UN agencies, are forming new partnerships with big tech companies. But at the same time, we really note a lot of concerns that have been raised by UN human rights experts and scholars about threats to privacy, non-discrimination, and the threat of potential privatization of public services. And in addition, because we're working closely with people living with HIV and vulnerable to HIV, we have over 3 decades of evidence showing the impacts of stigma, discrimination, criminalization, and gender inequality on health responses, and also the impact of these things on data, access to technologies, and access to power in different forms. And our consortium knows a lot about this, both through our research and also in some cases through lived experience of members of our consortium. So we really wondered when we came together how these inequalities would play out in the digital transformation. To be frank, we saw a lot of techno-optimism and concerns, but we really needed to understand the complex realities on the ground. And so as you see here, we set out to investigate how young adults in low and middle income countries experience the impact of the digital transformation on their human rights, including the right to the highest attainable standard of physical and mental health. We're conducting research in 5 countries, which each represent different geographic regions. Phase 1, which we've just completed in Ghana, Kenya, and Vietnam, we'll talk about today. Phase 2, which is still underway, we just completed a desk review in Bangladesh and Colombia, just finished the field work, and now starting on the analysis to develop findings, which we'll share next year. We're using, what's unique, I think, really about this study, we're using a participatory action research approach, which means that the people who are being studied participate in designing the study, in conducting the study, in analyzing the research findings, and in validating and developing the policy recommendations, which were all shared with people who participated in the study. And this has been shared, as Isla just posted, in an article in BMJ Global Health, how we use this transnational approach to participatory action research. We combine multiple qualitative methods to enable us to go deeper and explore the tensions between risks and benefits experienced by young adults using social media for health information and support. As principal investigator, I coordinated the study with support from colleagues at University of Oslo. And in each country, a researcher at a national organization coordinated the study and conducted the study in the country. So researchers at Kaylin in Kenya, at the National Association of People Living with HIV in Ghana, and at the Vietnam Network of People Living with HIV in Vietnam. And this is really 2 of our secret ingredients, I think, in the study that made it unique, the special sauce that made this unique collaboration work, where first of all, the experience that Kaylin has doing research, legal analysis, litigation, and advocacy in Kenya, but also the role of GNP Plus, and especially Namtika, in supporting national networks in Vietnam and Ghana, and doing a kind of translation work between all of us. We did online trainings in ethics and methods. We met weekly in an online research clinic to address challenges as they came up in the work. And where we could, we visited each other's field sites. We began with a desk review of laws and strategies. We then moved on to do focus group discussions, digital ethnography, and sites where young people gather. Focus groups with 174 young adults in 7 cities across the 3 countries. People between the ages of 18 to 30, and then 33 UN officials and national experts across 3 countries. We then did qualitative analysis of all these findings on Deduce. And lastly, we took our findings back to the people who participated in the study and asked them if we had gotten it right. So that's my overview of the methods. And I now pass over to Namtika to share the findings with you. Thanks.
Great. Thank you very much, Meg. I do want to quickly confirm if my sound is okay still. Awesome. Thank you once again, and a very warm welcome to our colleagues who are joining us today to hear this presentation after such a long year and some months of work. I do want to also send a special acknowledgement and shout out to my colleagues in Vietnam, specifically Trang Pham and Dudo Dang, in Ghana, Madam Elsie and Irene Podo, as well as in Kenya, Tara Imalingat and Alex Mutui, who, along with the rest of their teams in the countries, have been very central in putting together this research and working together as exchange researchers across the 3 countries. I also do want to emphasize that really, as Meg has mentioned initially, there is a realness in the digital health transformation, and this research in itself has really shown a lot of validity of the human rights acknowledgements and concerns for digital health technologies, including issues such as criminalization, data extraction that have proven to, in the way that it happens offline and outside of digital spaces, these inequalities continue to play a role online. But also the emphasis that has also been prominent in the past discussions around misinformation and different ways that we've learned about where that either manifests or is addressed. So one of our first key findings has been specifically based on the fact that young people actually appreciate having access to digital health technologies. They've described it as empowering. Google came up across a number of focus group discussions and even some key informant interviews that we've had, along with social media and informal contacts on WhatsApp as one of the ways in which people find information, find a community, find safe spaces to engage and actually address some of the concerns that they would often have offline, which would be going into health facilities and feeling judged and being identified, whether as a person or based on their sexual identity or sexual orientation. And the online space has actually afforded some people a platform to not necessarily feel that they have to out themselves. So people can be anonymous, they cannot necessarily be judged or rebuked as they would be in facilities. And the other thing that was emphasized as well is around access to safe spaces in an online family. And this came up in various ways, one of which was a WhatsApp chat, which is where young people, particularly during the COVID phase, were engaging on WhatsApp, and actually to an extent where they would have access to treatment and food and networks and community. But we've also identified, as Meg has mentioned, some innovative solutions from other young people and organizations who are supporting and encouraging having accurate and evidence-based health information. One of which is Love Matters in Kenya, which is a page that has over 1.5 million followers and really spreads positive and sex-positive information for sexual and reproductive health and rights, as well as the story of Pong's story, which we'll also hear about, thankfully, in this webinar, where it is a young person in Vietnam who's sharing HIV information and content to the community in Vietnam. And one of the things that have come up as well during this phase is that young people actually a lot of young women find a lot of information online, but more than that, it is a way in which they've also formed their own communities. And when we get to the area around digital health divide, we'll elaborate more on what that means, which brings us to the second finding around the fact that a lot of inequalities that we often see playing out offline, gender roles, socioeconomic class, education, disability, covering issues of accessibility, disability, sexual orientation, and gender identity play out very strongly in how young people access digital health technologies just generally. And these range from young people not necessarily being accessed, particularly young women, not being able to access funds for smartphones, or actually just being empowered to know how to use digital technologies or digital tools in a way that can provide them with information, but still maintain their integrity and free them from risks of any type of censorship or violence or harm, or actually data extraction. The other bit was one of the findings that we actually had during this phase was also in engaging with different groups of young people, which included groups of queer men and other MSM who have described being quite empowered when it comes to digital technologies, being able to use their phones, being able to protect themselves, and having ways and mechanisms to ensure that their own information and data and privacy is protected, against another group of female sex workers who had also admitted to using digital technologies to have access to either clients and some bits of information, but not so much information around how they then protect themselves should any forms of harm emerge in such instances. And so these are some of the direct, very dire, explicit ways in which we've come to realize how the digital divide is actually intersectional. And this is beyond the fact that, of course, internet infrastructure and those types of connection are also not necessarily equitably spread across the different countries. So the rural and urban divide, as expected, has had a huge impact, or has a huge impact, in how young people access digital technologies, how and which of those young people can actually even do any type of health tech and digital health work themselves. And so this, as a result of the digital divide and generally young people engaging quite a lot on social media, one of the things that was disclosed quite strongly is harms that's linked to seeking health information online. And these are young people who are often marginalized and disenfranchised, even in offline context, as indicated. And they include young people, people living with HIV, queer persons and men who have sex with men, transgender, non-binary people, as well as sex workers. And those are the people who've emphasized either the experience or the fears of being, of cyberbullying, being censored, being targeted for misinformation, especially in light of criminalization and the illegal abortion services, as well as all the experiences that LGBTIQA+ persons would face. So cyberbullying, violent threats, blackmail, extortions, all of those are experiences that continue to exist in an online platform as well. And so one of the key concerns around this is the fact that there isn't so much regulation around policies, if there are at all, when it comes to digital health access and privacy and data protection. Therefore, young people feel, as you can see from the quote from a Kenyan participant, that this is just something that a person would have to deal with on their own. And if you look at one of the points under the harms included, it speaks about anxiety and phone addiction, which means as much as this also has been a tool for young people to use to access information, one of their concerns has been that I'm not able to put my phone away. I'm constantly checking it for various reasons. Some because some of them are actually health workers. Some of them strongly rely on their devices to share information with their peers. But also some of them just feel that they generally cannot live with their phone. So this is another area that we had identified in our key findings that we are interested in looking quite a lot more into. And so as a result of this, one of the major concerns is around data surveillance, data and power, data extraction and power. And one of the examples that we always make is the fact that we went to, in the 3 regions we went to in Ghana, the northern region, which is also quite a rural region and community, does not necessarily have a lot of infrastructure for internet digital health access, yet we were able to find a menstrual tracking app called Flow, which is, I think, based in the UK, that a lot of people are using within that context, without necessarily knowing where their information goes, or at least having a thorough direction of the different channels through which all of their data and information goes. And this was also brought up by another exercise that we had during the focus group discussion, when we asked young people, where do you think your data goes once you either type that chat, press the search bar, or enter your details on a particular form online. And there were different responses ranging from a third-party company to the police, to other governments in other countries, or to the government in my country. And so all of this in light of still having a lot of criminalized and discrimination taking place in those contexts, of course, would then trigger a lot of fear of surveillance by police and third parties. There isn't necessarily a lot of regulation around digital health governance, particularly for platforms such as Google and social media, which aren't fully identified as digital health spaces, but are also spaces where a lot of young people go to access digital health information more than they would go to mobile health applications or other forms of digital health applications. And this also speaks to the issue of data. Nick Coldry, which they've sort of come up with a concept around data colonialism, which speaks to how data can be extracted from the South to actually inform and develop objectives for the North, and not necessarily addressing the needs of the communities from which the data is being extracted. And that has been one of the key concerns. And therefore, young people are calling for more open spaces for them to be able to engage and participate in digital health in interventions. Digital health literacy and empowerment has been emphasized quite a bit, as well as having a voice in policy making, and actually calling on health officials to take young people and bring them into the conversations as champions on social media. And what this means is that for digital health innovations, implementation across the board to be successful, or at least much more meaningful for young people, there needs to be a rights-based approach. And what that means is that it's taking note of young people's preferences for health information, such as acknowledging social media platforms, acknowledging Google as one of the spaces where people go to first to search for symptoms, understanding that there are people who are already conducting and are doing different kinds of innovation and empowerment strategies and ways in which they are engaging and bringing in young people as part of the conversation, but also acknowledging the fact that the online world, much as the offline world, is profoundly unequal, and many forms of those inequalities and forms of discrimination exist quite strongly within the digital space as well. And that there are generally harms that are also linked to seeking health information, because people do not know where their information goes when they enter their forms. And quite frankly, there is no regulation of what would then happen to that type of content and information. And so that rights-based approach to digital health governance and policymaking with a decolonial and intersectional lens is also what is quite crucial, but also allowing people the right to participate in defining their problems, finding solutions for the problems that they themselves are facing, and providing resources for those types of conversation to take place and for redress when necessary. And so what young people are essentially calling for is digital empowerment, because that means that across the board, people know how to engage with digital health interventions, are part of the design, implementation, and interventions and programs that have to do with digital rights. But also we need to start taking strides to addressing the digital divide in the various ways in which it manifests, whether from a point of gender, social class, geographic segmentation, and all the other factors, including ageism, actually. And then meaningful engagement as well in governance, design, and implementation of digital health, including inclusive design processes. So when we mentioned sexual orientations and gender identity, as well as issues of accessibility, that does speak to how these tools are designed for whom and how their needs are met through these platforms. And that includes how they navigate the platforms. But also, again, to emphasize the regulation of platforms such as social media and their impact on digital health access, which would then lead to, or at least initiate, conversations around redress and justice within that context. So that is it. Thank you very much. Please feel free to follow us on social media. And once again, just thanking our funders from the Fundación Botna, as well as some of our colleagues from the Global Health Center and partners who've greatly inputted and supported and mentored a lot of us and some of the researchers through this process. Thank you so much, Meg, and I'll pass the mic back to you.
Thank you, Tika. Stellar presentation, and really appreciated you highlighting both the way that these inequalities really profoundly shape the digital transformation in health, and also how they create these new spaces for solidarity, which I hope this conversation will be also. So that's the start. That's not the end, because we've got a lot to share with you today. It's kind of like a buffet with many different things for you to learn from and reflect on. So with this, it's a great pleasure to pass on now to my colleague, Professor Catalina Gonzalez Uribe from Universidad de los Andes in Colombia, who will share some of the initial findings from the second phase of the study in Bangladesh and Colombia. Catalina, over to you. Everything okay?
Yes, thank you. Thank you, Megan, everybody. Thank you for joining. It's great to see so many people connected. I just want to make sure that you have the right screen on it. So thank you for the introduction and great listening to Tika presenting the results. So as Meg mentioned, we also have 2 other countries coming in, participating in this research avenue. And I'm representing this group. I will be discussing what we've been doing so far from Bangladesh and Colombia, and some of the team members who I'm not sure if they're joining us today, but I wanted to mention them as well. So some people may ask, well, why Bangladesh and why Colombia? You know, what's interesting or important about them, apart from the research network that we've been able to develop through this project. Although there are significant differences between both countries, both share from different geopolitical perspectives many issues that are key for the kind of debate that we want to have. So there's been growing access to the internet, to digital technologies, including mobile phones and fixed internet, and both countries, comparable to others in both regions, nevertheless still face many inequalities within their own political organizations. These inequalities affect many different groups, but especially women and girls, for example, are key populations as well as migrant populations. So this to bear in mind and to have a context of what we're thinking of and considering when we wanted to understand, well, why would we want or need to discuss digital health and rights? And many things have been already shared by Tika and Meg while introducing, but I want to emphasize a couple of things. And I come from academia, so I do have this mindset for research. How do we provide evidence for policy and decision making? And I think that's a key point here to add to the whole purpose of why we ask this kind of questions. Health systems are being transformed, are being challenged every single day. Health, the health sector as well as the education sector, for example, have been historically underfunded sectors. But this doesn't mean that they're not being affected by the fast changes, you know, that have come not only because of COVID, but the accelerated digitalization of healthcare delivery using multiple digital platforms, for example. So issues have arisen in terms of privacy, quality, and autonomy. The data that is being shared every single day used to be maybe protected or not in paper, maybe got lost in translation or on these archives. But digital health now means we have information from communities, from people in general, from patients at a different speed. And it worries us how some of these historically marginalized groups in both countries, and comparing it to the countries that Tika presented, how can we think about these issues, highlighting the importance of staying ahead of the conversation and staying ahead of the changes that are needed. So there is a clear risk for marginalized groups, but at the same time, I want to balance this and mention that there is a clear opportunity for providing evidence for policy and decision making. We used to wait for surveys that would take place every 5 years, census every 10 years. Electronic records, digital records means we have data all the time. So we need that change in mindset of what we're doing. I want to share briefly, and I know you can see from my slide, some of the key findings we have for a working paper regarding Bangladesh digital health journey. So based on a lot of archive work, interviews, review of the policy in place, there are two key things. One that's shared with Colombia and many other countries. The COVID-19 pandemic definitely meant an exponential growth, something that we were not expecting, and that I think we still don't comprehend completely or know the consequences of all this. Bangladesh made a declaration called the Digital Bangladesh Ambition in 2021. That is, I would say, a result of all this different steps in time, introducing legislation framework for understanding how to address applications such as telemedicine and the rural-urban divide, and how all has been introduced. You know, these applications have meant we have many questions on how to regulate them, how to understand them, how to use them properly, how to make an efficient use, but also take care of the population. Some of the gaps and the challenges that we found specifically for the context in Bangladesh is that we're still missing regulations for digital health startups, health data, yet to come to be understood between a whole general umbrella, especially, and I remember our colleagues sharing this, there's a lot of the public-private health service providers division. How do we bridge this? It doesn't matter where this information is coming from, how it is being collected, being public or private. There needs to be a regulatory framework that provides a clear avenue for the data overall. And clearly there's an absence at the moment of a national digital health policy, but a very nice stepwise development that I shared with you in the previous slide. So for the case in Colombia, I want to share some statistics. Right now, the population has almost 80% mobile internet access use. And this is important if we compare it with Tika presented. It's not just having Wi-Fi at home and the infrastructure limitations that come with that. Mobile access is going to be key for understanding digitalization, health digitalization through apps and chat services in general. Almost 80% of the population, as I mentioned, have access to this mobile internet, and internet penetration is currently wide. There is an urban-rural divide, and there's a socioeconomic inequality in accessing this kind of technology and opportunities, not only in terms of access, but in terms of quality, of speed, reliability. Regarding the legal and political framework, I want to focus on three things briefly. We had to go back to 1991 when our constitution, our 1991 constitution was developed. And we found 3 articles back then that already meant an important start in this conversation. We're thinking about the right to life, right to public health and environment, especially Article 15, right to privacy and access to information. This one was introduced back then and left within the Constitution, providing some ground for the specific legislation in 2012, the framework that provides guidelines and guides to privacy and data protection. So as you can see in the slide, there's already some development early in the 1990s, early in 2010, 2012, and how to define the type of data that is being produced, how to legislate on that, and the consideration of data classification, of that there's some data that is sensitive, that should not be shared, that should be regulated. These are principles that have been discussed from a helicopter view. So how do we put that into applied areas? How does this translate in the Colombian environment? We have telemedicine as an important issue being discussed, and I'm highlighting a few bullet points here of the things that we need to bear in mind when it comes to cybersecurity, electronic medical record, and so forth. So I want to finish just by mentioning that we find landmark development in Colombia, as well as the stepwise progress in Bangladesh. But we see opportunities here to connect with the discussion today of how data is being produced differently, how do we protect this data, and how we can use this data to leverage inclusive policy. Thank you.
Thank you so much, Catalina. Very rich findings from that desk review. So as I mentioned, our colleagues in Bangladesh and Colombia are now finishing up the data gathering, and then we'll have findings to share next year. So we're excited for that. As I mentioned, we have this rich buffet, lots to offer you today. Before we go to the roundtable, one of the key findings from our study was the incredible impact that some social media health champions and others have had using mobile phones and mobile technologies for health for young adults. We wanted to share one example from Vietnam. And so we're going to share a quick little 2.5-minute video made by our colleague Trang Pham interviewing Phong from Phong's Story.
Thì anh Phong có thể chia sẻ một chút về bản thân cũng như là cái quá trình làm việc trong lĩnh vực HIV cho đến thời điểm bây giờ được không?
Mời tôi tham gia và tạo cơ hội cho tôi được tham gia cái buổi phỏng vấn này. Tôi tên là Nguyễn Anh Phong, tôi đại diện cho mạng lưới của người sống HIV Việt Nam, điều phối cho văn phòng phía Nam. Tôi tham gia trong lĩnh vực hỗ trợ và chăm sóc tư vấn cũng như là đồng hành với lại cộng đồng của người sống HIV. Đến nay đã được hơn 10 năm, và trong quá trình thì đã hỗ trợ và chăm sóc khá là nhiều người, và cũng có khá là nhiều cái câu chuyện cũng như là có nhiều cái phương pháp để tiếp cận hỗ trợ. Trong đó cái việc mà bởi vì thật ra thì khi tôi làm về cung cấp thông, chủ yếu là trong cái quá trình mình hỗ trợ và chăm sóc thì mình thấy mọi người bị thiếu thông tin. Khi họ tìm kiếm lên kênh Google thì sẽ ra rất là nhiều những cái thông tin không chính thống hoặc là những cái thông tin chưa được kiểm chứng. Nhưng có một cái đó là cái người dùng họ không biết sàng lọc, tức là họ chưa biết sàng lọc như thế nào để gọi là thông tin đúng và đủ. Chính vì vậy cho nên là mình mới nghĩ đến là mình phải cung cấp thông tin ở trên mạng xã hội. Và khi mình bắt đầu cung cấp thông tin thì mình mới thấy được những cái hiệu ứng và những cái phản hồi bất ngờ từ và hiệu quả từ chính những cái người xem những cái chương trình ở trên cái kênh YouTube. Thì ví dụ như mình có một cái chương trình mà mọi người rất là quan tâm, đó là cái chương trình không hiểu hỏi, tức là bạn không hiểu cái gì thì bạn sẽ hỏi cái đó, và tất cả những cái không hiểu hỏi này nó xung quanh về vấn đề về HIV, về vấn đề giới tính, về vấn đề hành vi nguy cơ, và mình thấy người ta quan tâm và người ta hỏi nhiều nhất, và các bạn trẻ hỏi nhiều nhất. Thì mình sẽ thì họ muốn quảng bá những cái dịch vụ đó thì họ phải có họ phải sử dụng, họ phải theo dõi về những cái mạng xã hội. Ngoài ra thì những cái phương pháp để làm một cái hình thức để làm lên những cái việc cung cấp thông tin, ví dụ như clip nè, ví dụ như clip phải làm như thế nào, tức ra làm sao, những cái bài post phải như thế nào để thu hút được cộng đồng người trẻ, thì đó cũng là một trong những cách mà họ cần phải trao đổi nhiều hơn, phải tìm kiếm những cái chuyên gia, những cái người chuyên môn về những vấn đề đó để có thể tư vấn hỗ trợ họ thực hiện lên như điều đó, thì nó sẽ tốt hơn và tiếp cận được nhiều cái đối tượng mà họ mong muốn hơn.
Great. Thank you so much. So that's Phong's Story, which is an amazing account on YouTube with, I think, over 30,000 followers talking about HIV and sexual reproductive health. So I'm going to pass now for a discussion more about how we can use social media for good, how we can learn from these findings for policy, passing to Tigis Tamrat, Technical Officer on Sexual and Reproductive Health Rights at the World Health Organization. for a conversation with Stephen Agbenyo, who's Executive Director at Savannah Signatures in an NGO in Northern Ghana, Terry Gachet, who's Country Coordinator of Love Matters Kenya, a community on Facebook that I believe is following us live, and Tabitha Ha, Advocacy Manager from Stop AIDS, who leads advocacy for our consortium. And Tika and Catalina and I will also stick around for the discussion, but over to you, Tigas.
Hi, Meg, and thank you very much for this opportunity. And as introduced, I'm Tigas from the World Health Organization Department of Sexual and Reproductive Health and Research. It's been really interesting to hear the different presentations as well as the video about how digital is being used across the diverse needs and populations among young people, and for sexual reproductive health and rights as well as HIV. I think maybe just to kick off the discussion, one question from the WHO perspective that we often debate is what should be the role of WHO in these very organic uses of digital health that are almost owned by the people themselves, the youth, the young people that are managing it. And I saw a chat actually that said, who actually is managing these different platforms? Is it young people themselves that are also marginalizing other youth? And so when these discussions happen, what should WHO's role should be, if at all, within these very important platforms that have a lot of traction and that have a lot of usership? So that's one thing that we think about internally. And it'd be great to hear from the experiences from panelists as well as from the audience, from those that are online, thoughts on this, as well as other thoughts that have emerged from the discussions from all the presentations. So maybe I'll hand off to my fellow co-panelists, whoever wants to take a stab at that.
Hi, Jess. Can I come in?
Yes,
Can
please.
you hear me okay?
Yes.
Okay, great.
Thank you.
So with the WHO, I think because there are some regulations that we need, there are some collective approaches and joint approaches that we need that transcend borders, right? We've heard in the presentations the concerns of giving up data and the impact on privacy. And actually, it's often tech and social media companies that work internationally that hold a lot of this data and need to be held accountable to human rights. So the WHO can play a role in bringing governments together to discuss that. But not just that, they can also provide more technical support. And to do that, we need to include social media and Google searches in, now I can see my face quite big, social media searches in the WHO's definition of digital health. And that will help us to then support other global health agencies to consider how they tackle social media as well. Yeah, I'll stop there.
Yeah, no, I think, thank you, Tabitha, for that. And that's definitely something that WHO is trying to learn how to play with the big tech companies that have, that have actually advanced the space a lot further than probably WHO. And WHO is almost coming into this from a very conservative, traditional way. Okay, how do we do this? But the train or the boat, the ship, everything has already left the station, and WHO is trying to catch up. So I think those are really good suggestions to see how can we include things like Google searches. I know that there is a unit within the Digital Health and Innovations Department that is looking at digital channels and how WHO can try to influence those digital channels as well. And just looking also at the chat, in terms of, grassroots innovations, and Stephen and Meg, I see that there's a discussion happening there. What would WHO's role be in these types of grassroots organizations that part of the really great value that they add is that there isn't this interference that comes from a top-down organization like WHO. And, that's been really the success behind it. And so if an institution like WHO was to come in, how would that change the dynamics, and how would that potentially influence the way that young people, use social media, young people create these types of content. So it'd be great, maybe Stephen, if you would like to chime in and add any reflections on that.
Yeah, thank you. For me, I think that WHO, yes, is at the high level and overseeing and providing guidance and ensuring that standards are maintained. However, I think that you could also play some other roles, major roles, particularly in recommendations about which digital interventions are supported by demonstrable evidence. That is key, demonstrable evidence. Innovations like ours that we use here in Ghana may never come up in your high-level searches because probably we do not have the millions of dollars invested in them, and so they will not ordinarily come out. But these are real on-the-ground community-level platforms making a lot of impact. And for me, if you limit, WHO, your data acquisition at the high national levels, you will miss such critical platforms that are changing lives, that are making a difference in the lives of people. I want to submit that WHO can support such platforms by being interested in real community level data information about what's happening. And that is where the real impact is. And you can help by supporting, by promoting, and by being very explicit on such platforms, because then it gives them the publicity that they also need, the leverage that is needed, and also brings on board the support. So for me, that's really what I can say about, WHO's
Apologies, is it just me or did the screen freeze?
All okay here?
Might be you.
Yeah. Sorry, Stephen, please
Okay,
keep going.
apologies.
No problem. So I don't know which parts you missed, but I was just saying that, so for WHO, yes, high level, but if in terms of data gathering, because we know you gather all kinds of data from country levels, these kinds of inquisition, if it's just limited at the top level, you may miss out on some of, these real life transforming, changing products and platforms that are making, changes in the lives of people. And how you can support, I think that it can be very explicit on some of these local level products that are making, impact in the lives of people, and then be very explicit on them and promote them. This way it will help. But of course, you still maintain your overarching, supervisory, technical support, standardization roles.
Mm-hmm. No, I think that definitely makes sense. And that is a balance that I really welcome this, this input, because I think that is a balance that we'll try to achieve, at least in terms of trying to really identify those things that having to have a lot of impact. And as I see also through the chat, that's really where a lot of people are getting their health information from. So if there's a way that WHO can, amplify, or ways to be able to influence in any way the health content that's there, and kind of try to make sure that we don't ignore those types of very grassroots, community-based, bottom-up approaches. So thank you very much. I think this was just a few things to get us started, and I'm going to also just look at some questions in the Q&A. So I see that Professor Gonzalez-Uribe is also typing an answer, but Omar Sharif has a question about what was the likelihood of accommodating key populations and other marginalized communities into digital health policy infrastructure while they also criminalized populations. So maybe if Professor Gonzalez, if you'd like to open your mic back up and take that question live.
Thank you there. Yeah, no, we were discussing how important it is to have a look at this. I'm thinking criminalized populations, and also in the context for Colombia, people affected by conflict, for example, migrant populations as well. Providing information about yourself, about your identity to access health services is an issue. So you still need that, you have that right to health, but accessing becomes an itinerary full of barriers. So I don't have a straight, forward answer. I'm just guessing this is just so much important. I'm going to make a few comments regarding migrants and conflict. I know Tabby and Tikan raising their hands as well.
Okay, maybe Tabitha and Tika, if you would like to go ahead in that order. I see Tabitha took down her hand, but maybe go
Yeah.
ahead and then we can go to
So we
Tika.
took that down.
Okay, I'll go first.
Okay, I'll go.
Okay, Tika, you
Go
go.
ahead, Tika.
Yeah, let me just go quickly, T. So I think this goes back to the question about, are young people also marginalizing young people? And there's a lot of these young innovators, right? So Love Matters Kenya, I think She Plus, the innovation happens in already existing big tech platforms. And so it can be a safe space for young people to hop onto those platforms to be able to get access to information services and the community. But then there's a bigger concern, which we cannot answer, and which we hope that this is where WHO can also tap in, where we bring everyone to the conversation and say, well, we've got this platform such as Facebook, and I think WHO has also done incredible work with WhatsApp and using WhatsApp as a tool to disseminate, accurate information, as that's one of the common mediums. But there's also the concern of, but I'm still a person who has an account on this platform that this innovator isn't necessarily able to control. So I can only support and facilitate the engagement on the Facebook page or on YouTube or on Facebook or on Twitter. But what happens to that information and whatever questions people ask on that chat externally becomes a concern. And that's where we sort of want to find that linkage between either a support structure and organization and institution like WHO really making the young innovators work meaningful, especially those who are using platforms such as Facebook and YouTube and already existing platforms, making sure that those platforms are regulated. And that is the workshop, I believe, that still needs to happen, as to how do we facilitate the relationship between disseminating accurate information to people who might be at risk, who might be marginalized, who want to hop onto this platform to access that content. So it's not just one player. And this is besides, I think someone alluded to the fact that some of these interventions also come through programs. So there's funding for a digital health innovation with that particular community, but not so much accountability back to that community once we've done that pilot phase. So there's little bits of ways in which digital health is manifesting, whether on social media or on other online platforms, where we need a lot more support and regulation and direct involvement of young people and other communities into how then information data is managed and how is that sort of data protection system or laws or mechanisms, how those are regulated so that people can actually trust the platforms that they hop onto.
And yeah, I think you said a key word there, which is trust. And oftentimes trust is the big issue because sometimes the platforms that are provided by governments may not actually have the trust, and therefore why there are alternative platforms that are being used. So I think those are really great suggestions for us to think through. Maybe we can hear a little bit from the Love Matters Kenya on Facebook, who I know have been doing a lot of great work on this. So if you would like to open your mic from there and speak a little bit about your experience in this type of work.
Is this our audience or is that directed to me?
It could be directed to you, Terry. I'll take you as yes.
So your question is on our experience using digital media to disseminate sexual health information to young people.
Yeah, I think just your general experience, and if you have any questions that you'd also like to ask to fellow panelists as well, to add on to this conversation.
Yeah, sure. I think one of the challenges we've been facing, of course, is censorship. We post information on sexuality, sexual and reproductive health, and as you know, we are very bold. So we use a sex-positive approach, right? We want to speak the language of young people. And what happens is that in most cases, that information will be flagged, and that is perhaps escort services or inappropriate for audiences. So that content is taken down. We cannot run ads on SRHR, because often they are, taken down. Perhaps with WHO can be the constant voice in this, because you understand we are donor funded. So when the funding is not there, perhaps you're not able to push certain courses as far as we would if we had the funding. But WHO, I think, has resources at their disposal, and of course, being an authority in the area of health, ensuring that there is that consistent conversations with the big tech companies in terms of this is, SRHR information, this is what young people want to see. Therefore, it's not content that should be labeled as inappropriate or escort service, or sometimes very explicit terms are used to label our content in the name of they are violating the policies. And sometimes those policies are quite gray, because when they label something as nudity, and sometimes they say you can share sculptures, and when we do that, then it's labeled as something that is inappropriate. So perhaps WHO being that consistent voice, and keeping in mind that we're in this journey together. At the same time, I think you have more authority than we do in this specific fight.
No, thank you, Terry. Thank you for that as well. I also just wanted to build on this, your response, and see from other panelists, because we had some additional questions in the chat about how do you safeguard safety, and how do you, the safeguarding. And I think the question is from Shivam that says, can you also share thoughts and examples of how safety and safeguarding can be part of the design rather than an afterthought? And I think we heard some really good examples from Terry and Love Matters. I'm wondering from other panelists as well, if there is, if there's anyone that wants to add to this in terms of how they've managed the issue of safety and safeguarding within the design of these different platforms.
Michael, don't want to take up too much space. Thank you for that. I was actually just about to type a response to Shivam to say, I think that definitely depends on the platform and the intervention in itself. But one of the things that has been critiqued a lot in the design justice space, which really critiques how the design processes, particularly for digital and other spaces, have been curated over time, is that there's often different steps in the usability or user research phase where you find out what is it that people need. And one of the very practical initial steps is to find out from people who are your prospective end users, if we are talking specifically a digital platform or a space, what are their safety concerns? So some of the questions that have come up here, is this a platform for people living with HIV? Is this a platform for sex workers? Is this a platform for young people in their diversity? And in that regard, what are some of the concerns that they have, and what best measures can be done from inception phase to address that? And so just from a design perspective, I think that could start preventing and not necessarily eradicating, but at least preventing some of what could be the worst cases around either data or security breaches and things like that. And so if people are saying, we like the idea of a chat room, but we are concerned that there might be an imposter or someone who hops in and, writes something that's either discriminatory or is insulting to other people in the group, how would that platform be moderated? Or if you are asking me information around my sexual orientation and gender identity, how are you going to use that information to help me benefit from using this platform? So it's really critiquing why we are collecting certain types of data and how that data is going to continue to empower the people from which we are getting the data from, but also just doing a thorough scan and understanding from people that we've defined as prospective users of the platform or people that will access the information, what are some of their fears, and how can we very actively and proactively ensure that some of those are at least addressed and prevented in the initial stages while we are figuring out the bigger scheme of governance and the regulation of these platforms. It could really start, I think the design process is one of the most crucial ones, and Dr. Sasha Costanza-Chuck has done incredible work on design justice and some of the ways in which we could meaningfully involve communities from inception phase. And so the issue of security concerns is part of those discussions in that inception phase. Thanks.
Thank you very much, Tika, for that. And just wanted to maybe first take a step back. I think we jumped right into what can we do and how is this being done, et cetera. But just wanted to ask generally from the research findings that were presented, was there anything that, did the findings surprise you at all? Was this what you were expecting to find, or how did it influence your thinking and future programming? So maybe if we can just take a step back to what we heard a little bit earlier at the beginning of the presentation, just to hear from anyone that, what your actual reflections were in thinking back through the findings of the study. Maybe I'll call on who has not spoken, or maybe I'll ask Catalina. How did what was your reaction to the research findings that you presented on?
Tigist, thank you. I had the opportunity to share a little bit of that, and all of this helps us to think how we want to discuss it. But I'd love to hear from Terry and Stephen, who have information about youth-friendly, approaches, and I think that will be excellent for us before we go deep into the analysis. Terry.
I was not surprised. I think much of what was presented was quite relatable in terms of young people having a preference for digital media to access health information, and with a specific bias to SRHR, because we live in very restrictive and culturally conservative settings. So it's not a space where they can just go to their neighbors or big aunties to ask. So digital media becomes that other place they can go to and access health information. So that was not surprising at all, because the high engagements we get is testament to the fact that young people have a preference for these platforms. The other thing is the concern for safety, and we have seen that through various ways, especially young people who perhaps are not so comfortable engaging with us through the comment section or the comment section of the website or social media. They will come to our inbox, which is more private, and there's always a request for kindly don't share this information publicly. Or sometimes they'll come and say, I have a question that I want you to ask other people in the community, but kindly don't reveal my name. So that has really been a conversation we've been having internally in terms of the quest for privacy when they are engaging with us. And the other level is when we are referring them to health services, right? We have to seek consent first, because there's the law that guides on how we can use this information. At the same time, you realize we cannot, for instance, tell service provider A that Meg came and Meg is on our platform and she is seeking healthcare services. We have to use codes. So in that way, we give assurance to our audiences that we are not passing any identifying information to these service providers, and that has really helped them in feeling safe, such that the information is not being shared by anyone, because sometimes they'll come with conditions they would not like everyone and anyone else to know about it. So yes, concerns for safety and security have been very noted through engagements with our audiences.
Thank you, Terry. And maybe Stephen, if you'd like to also share similarly on your experience in doing this work in Ghana.
Right, yes, yes, thank you. So the research, raised the issue of the She Plus helpline, and which is making rounds here, particularly in the northern region of Ghana. It's an adolescent and youth-friendly engagement platform that runs on a toll-free number. It's a helpline that provides basically 3 critical services: information, counseling, and referral services to its callers. First, to the northern part of Ghana, because that's where we are situated, but because it's a free number, it can be accessed anywhere across the country. Now, presently, the She Plus helpline provides services in about 9 different Ghanaian languages, and we receive on average about 120 calls each week. Now, some of the issues that keeps coming up: menstrual hygiene, STIs, contraceptives, safe abortion, care services, gender-based violence, etc. Now, why do we use the toll-free number? Costs of airtime, data bundles, etc. are potential barriers to reproductive health service. And we actually are seeing it, that there are barriers to service utilization. Now, within our context, even variables such as the distance where, callers are, if they are the last mile and connectivity is a challenge, they are not able to use social media platforms like Facebook, in search of Google and all of that. More so, young people, yes, by the day, we are seeing huge numbers of young people who are using smartphones, but there are also a good number who do not have the funding to be able to use smartphones, talk less, have money, financing for buying airtime and data and all of those things. So for us, the toll-free number, which you can just use a normal feature phone to call, and you do not pay for the airtime of the call, becomes very handy for the people who are here that we work with in the northern sector of Ghana. And that's why we are focusing primarily on the helpline, which is a toll-free number. Now, we think that it's not just a hotline, but it's a hotline, and this is linked to some of the key issues that's come up in the research that provides that privacy and confidentiality. Because yes, it's manned by health workers, manned by counselors, but the issue is about confidentiality, it's about the privacy of the callers, and it provides a safe space to young people who call, and language does not become a barrier to them because they can opt for any of the languages that they can freely express themselves in. And for us, that's very critical. And for me, it wasn't surprising that this research also highlighted the issue of people making anonymous searches, raising the issues of privacy and confidentiality, and critically, the issue of provision of safe spaces for them to be able to confidently be able to access the kind of service they want to access.
Thank you, Stephen. No, that's great. And it's great to see the efforts that have been made to really make this, truly accessible across different languages and across different populations. I think now maybe moving to Tabitha, the research findings that were presented highlight not only benefits, but also risks of digital health. And so in your recommendations, what can governments and UN agencies do to address these risks? Now moving from the benefits and all that we can do to now trying to understand how we can also address the risks.
Thanks. And yes, there definitely are risks. And we're so excited now that we have these evidence-based research and recommendations that we can really take these forward with governments and UN agencies to address these. And it's going to require swift and brave action, because it's not easy. It does require us to challenge those driving the digital transformation, to take a more diligent and participatory approach. And so I would say there are three kind of main areas, 3 key points I'd like this participants to take away from this call. One around strengthening laws and policies, secondly around the meaningful participation of communities, and thirdly funding initiatives that digitally empower young people and communities. And I'll explain a little bit more about each of those. So to dive into the first, this is all about creating stronger norms and policies and laws that better regulate the use of data and technology in health, especially privacy and data protection, as we can see from the other speakers, how important that is. And we need to be able to hold stakeholders to account through these. Our research at the national level in Kenya highlighted the problem that Kenya lacks a comprehensive legal framework and rather relies on a patchwork of different standards which are not effectively enforced. So we need governments to plan for and invest in the enforcement of existing data and digital policies, and where they are weak or non-existent, they need to be strengthened and in a transparent manner, and then to ensure redress for online related harm. So this requires governments, donors, and others, including our own communities, to be knowledgeable about and be able to apply these policies and frameworks. And we also need governments, with the support of WHO, but also other UN and global health agencies, to nationally roll out existing guidance, such as the great rights-based and ethics-based guidance from UNDP, as well as WHO on digital health and AI. And at the global level, I discussed a bit around the WHO and including extra terms in the definition, but we also need UN human rights mechanisms to take more of a stand and to lay out a normative rights framework around the use of data and technologies. We also need kind of cross-UN action with UNDP, ITU, WHO, and UNAIDS to support member states to address the shortfalls and gaps in digital governance. And that relates to the point I mentioned earlier around having international companies that transcend borders, and therefore we need a more collective and joined-up approach. The second one around meaningful participation of communities is so important, and especially if we're going to address some of the issues like criminalization and other systemic issues that tie in with digital health and rights to access. So human rights standards actually guarantee the right to participate in development cooperation, and by supporting the engagement of these communities in decisions from start to end, we can better address the risks and meet the needs of these populations. And we can also ensure that technologies and digital governance evolves as realities change. And then finally, around funding, and quite a few of these have been mentioned today, we need to digitally empower young people and communities and engage them as partners in the digital transformation. So I particularly want to highlight digital rights and literacy training, which we heard a lot around today, support, investing in community-led initiatives, including quality of life initiatives, for example, that address mental health and well-being, as well as others that address the digital divides. We've heard the importance of free data that requires, infrastructure investment to expand equitable access to health services and information. And I think, we've learned so much from the social media platforms and entrepreneurs on this platform and this call today. So we need to ensure there's collaboration with these champions and investment in the effective use of social media to reach young people. So, and I think just one additional point is that UN and global health agencies would be able to guide that funding better if there was a set of evidence-based interventions that address digital divides and digitally empower young people. So through the stronger digital governance and participatory decision-making and funding these interventions, we can begin to shift to a world in which the use of digital technologies is moving us towards this digital justice and being careful about these risks.
Great, thank you. Thanks, Tabitha, for that really comprehensive response. So I think we have some questions that are piling up in the Q&A. So I'm going to now hand off back to Meg to lead us into the Q&A. But I just want to thank again all the panelists for sharing your experiences and letting us know a little bit more about the work, and hoping to see how this can be better amplified as well, and your the learnings to be shared more widely. So over to you now, Meg, and thank you.
Thank you so much, Tigist, for leading that discussion. Really appreciate all your support and advice through the course of this project. Yeah, we do have some great questions showing up in the Q&A, and I think really following on Tabby's discussion of the recommendations. One of the questions that Kiva shared, which I really wrestled with too, is this question of how we push for more regulation of digital health. We push for social media to be part of digital health strategies and policies, because we see that's where a lot of young people are. But at the same time, it could, as Kiva points out, it could have a negative effect, right? Could lead to more of the kind of censorship that Terry is describing. So I wonder how we manage that balance, and would love to hear from anybody really on the panel. Maybe I'll start with you, Tabby. How do we balance that tension between wanting more governance and then also not censoring one of the few spaces where young people can get sexual and reproductive health info?
Yeah, I think it is tricky, and I would point to the example from one of our partners, Kellen, in Kenya. They work with key population networks in Kenya, and those networks had to deal with a government initiative to use biometric data to track better how key populations were accessing healthcare and services. And so by engage, well, firstly, the key populations networks had to put up a fight, and they succeeded, and they were just in discussions with the government and other supportive partners like the Global Fund to actually work with the government to understand how they can better track key populations and their access without using biometric data. So that is an example of it's why it's so important to engage civil society and communities and young people throughout the process, so that if there's going to be greater regulation of digital health on social media, perhaps the language used, we need to engage with those networks to understand what could work with them. Where do they feel that that barriers will be put up or they will be challenged, and how can we work together to develop that regulation, test it, monitor, and again get further feedback from them, whilst also funding initiatives that help them to navigate that space and continue to get good quality information to their peers.
Thanks, great points. And I wonder also from Stephen and Terry's perspective, if you have any thoughts on how more government involvement in social media, would it be helpful or harmful? Maybe as we see Elon Musk taking over Twitter and all of the craziness that's going on there, maybe we want more regulation. I don't know, any thoughts from either of you on this?
That is a tricky one. Because coming from where we stand as Love Matters Kenya, we focus on pleasure content, we're sex positive, and we are not using scare tactics to teach young people on sexuality and sexual reproductive health. It's a tricky space to be, being in the same table with government, because the moments we have been, conversing with government, we try to filter, we find ourselves trying to filter the extent of what we do, because as well, that will mean them really trying to find out, what are you doing? Whatever you're doing does not align with, the values of our country, because, we are inclusive, right? Therefore, it's a tricky balance, and we find ourselves going behind sometimes organizations to just be on the table with government. However, it would be really, really interesting to see them get into a space where they understand that we are not just coming to create this demand. This demand is already there. Young people want information on SRHR, and they want us to be sex positive, right? So perhaps us getting into a space where that can be acknowledged and appreciated by people in government would be really helpful. The other thing, I think, just to say that we have made a bit of strides with regards to the tech companies, because Meta recently said that they will not be censoring SRHR information, which is it's a win for us. However, they still say that when it comes to pleasure content, they will still censor that. So it's sad, because this is how young people want us to engage with them. This is the language they want us to speak. Yet Meta is still at a place that they are saying, no, pleasure positive approach, pleasure content, no, that we will still censor. However, it's still a win, right? If they're saying we will not censor SRHR information, so perhaps it's about us going a step further and engaging with them. Government will still have to figure that one out, how we can boldly go and tell them we are an inclusive platform that caters to all young people in all their diversity.
Yeah, thank you so much for sharing that. And especially going back to Benjamin's question in the chat about, was it Benjamin? Oh, sorry, it was Omar who was asking about inclusion of key populations who are criminalized. And it's, it's really interesting tension, right? Because we want to make sure that we create safe and inclusive spaces to the degree it's possible to make spaces maybe safer, can't make them entirely safe. But I wonder also, Stephen or Namtika, if you have thoughts, please.
Yeah, Meg, I think that it's a tricky position to be in to make, comments about this, because it's a fight between age appropriateness of content and now this government thinking, right? Age appropriateness of content, culturally sensitive content, as against comprehensiveness of information that young people need. And for me, that's really where the turf war is. If you ask governments, of course, to provide regulations of all of these, particularly for governments that do not have e-health policies guiding them, the key focus will be age-appropriate information and culturally sensitive information, as against champions like us who will say information must be comprehensive, to people. So it's not a yes or no thing, but it's just a dilemma, in the mind. And I think that's going to be an ongoing conversation.
Yeah, thanks very much. And I see Levi posting this caution about unintended consequences, which I definitely agree with. But at the same time, the young people that we met with were experiencing serious harms too. So there need to be some consequences. There needs to be access to redress as well. Terry, I see your hand up, and then Tika, please.
Yes, there was just a mention of comprehensive, and I remembered we had a fight with government agencies, because we started with sexuality education, then they said, no, don't add the word sexuality. Comprehensive sexuality education, they don't want that. Now we are at health education. So even the name itself, it's a problem. They haven't even looked at the content. So as my colleague said, it's not an easy fight. However, it's not something we're giving up on.
That's a spirit. Thank you. Nantika, please.
Yeah, absolutely. Actually, just tapping onto what Terry is saying, because I mean, comprehensive, just adding that term in sexuality education alone, even in some UN spaces, it really changes the dynamic of the conversation. I think, as a lot of people have alluded, it's definitely a tricky one. I think it's trickier for the partners and the actors we would like to bring in than it is for the innovators and the people who would want to have more involvement, because the issue of governance, it can easily, from the government's perspective, or at least, you know, at the decision makers' perspective, be translated as control. And that's where the concern is, and that's where the trick is, because at the end of the day, even how we define what governance looks like for digital health still needs to be an inclusive process that is informed by what works. And of course, that's much easier said than done, because we could easily say, look, we've got 1.5 young people actively engaging on this content on our page. They need it, and we can actually see and hear from them that it is improving their health outcomes, whether in terms of access to service and information. But I think there's something quite critical about reflecting on the need for digital empowerment. And we've been toggling a lot between, is this just digital literacy or is it empowerment? And I think what that means is across the different communities that we are engaging with and are talking about, and that digital empowerment will inform a lot of aspects of how they navigate these platforms, but also what does this governance mean, and what does it mean for them to then be part of that kind of discussion? What does it mean for me to be a person that is implementing a digital health platform, but I can see that the funding that has been given into the organization isn't necessarily enough, or there isn't enough time for us to go beyond pilot phase? And how do we sort of manage and regulate that? So that in itself is an aspect of governance, but also looking at who's online, what kind of information they're accessing, and what we do with that information. If it's something that isn't necessarily benefiting and serving back to those communities that said, you know, why are we overly policing that? So I completely agree that it's really tricky, but I do think that the challenge is still in ensuring that the actors we are wanting to bring in should not come with the regular status quo or the regular ways in which they enter into spaces, especially when the conversation is around decision-making and governance, because then that will shape how that kind of process and mechanism is workshopped across the different actors in digital health interventions, whether they are innovating, implementing from a program's perspective and have received funding, but also if they are end users and recipients of care through digital technologies as well.
That was so beautifully said, Tika. Thank you. And I think one of the things that really came out clearly, you know, and we've mentioned about Flow, which is a menstrual tracking app, which we found in Tamale in northern Ghana, that young women were using this to track their periods. British app, right, which had actually previously been settled a case in the US because they'd been selling young people's data, young women's data, or people who menstruate, to Facebook. So US had cracked down on them, but that has no implications for young people in Ghana, right? And so I think we have these real geopolitical inequalities as well that really have to be addressed, what some people call data colonialism, with the extraction of data from young people in low and middle income countries for profit in largely unregulated, as Alan Malici points out, companies that are in the global north. And that is really, really problematic. So I think in order to find solutions, we really do need broader digital literacy, broader discussions based on the kind of research that we're doing here to think about how to address these inequalities. Maybe Catalina has a solution. Catalina, please.
Now, I want to second this comment. I struggle with the thought of thinking that legislation is going to sort it out. In Colombia, we have beautiful legislation for decades, and that didn't translate into resolving conflict, into resolving inequalities. I second empowerment. I second data empowerment, digital literacy empowerment, and understanding what we can do, because legislation is not fast enough, is not accurate enough. It's impossible to have under one umbrella, you know, an inclusive approach. So we need some intermediate levels of governance that groups can, you know, use as tools and that can evolve continuously. This is a dynamic scenario, you know, all year round. And I was giving the example, We used to have census data to think about legislation. For example, sexual and reproductive health rights framework in Colombia used a survey every 5 years. Now we have data every single second. How do we make better use of that? How do we protect? How do we allow for that? That's a discussion that's going to take a long time. So I second empowerment. I second, building into that. Meg, your microphone.
Sorry, always happens. I just wanted to acknowledge that we also have Trang Pham from VNP Plus with us, who you saw briefly in the video, who did this beautiful research in Vietnam when it was largely locked down. So I just wanted to see, Trang, if you wanted to come in on any of these points on digital literacy. So we'll give you a second to see if you want to say anything, and maybe come to Tabby first, then we'll come back to you. Thanks.
Hi, so it's building on what Catalina said and really putting forward a call to action to all the activists and civil society and others on this call. We need to really kind of galvanize our movements and our communities, because regulation is going to be a slower process. So from in the HI movement, we had this model of treatment literacy where we would train trainers, and those trainers would go into their communities. And I think we need a similar approach really for digital literacy and rights. We've worked with this consortium, and particularly with the leadership of GMP Plus and with the engine room, to understand the needs of our networks when we talk about digital literacy and rights, what their most important needs, what are the challenges they face. And we've started to develop a workshop resource and some of that training, which we hope to roll out more next year. But that has a whole set of interactive exercises about how do young people really identify all the different ways that they, use their phone, use the online services, in their regular everyday lives, and therefore how do they better have rights over their data and understand issues like consent. So yeah, it was a bit of a call to action to others in this call.
Lovely, thank you for that. And please, everyone, follow Stop AIDS, GNP Plus, Kaylin, who are with us on this call today, and all the others that we've been sharing. Trang, over to you, and then we'll start to wrap up here.
Yeah, so I just want to share quickly about my experience when I involved the research. So when I interviewed the key population in Vietnam from 80 to 30 years old, so I realized that they really need the digital health literacy, because actually they really concerned about the personal security and also the misinformation when they access health services in Vietnam and online. I think it's not only the main problem, not only in Vietnam, but also in another country. So I'm really want to give them the opportunity to join the digital literacy training in Vietnam also, and another platform and another webinar for KP in Vietnam. Yeah, so I think that's just quick to share. Yeah.
Thanks so much, Trang. I think we're just about running out of time. I feel like we could talk about this much longer. I just wanted to also acknowledge Irene Poto from Ghana, who is just posted in the Q&A, and who did also an amazing job with the research in Ghana under very challenging circumstances too. So really an amazing team, and such a privilege to work with everybody. Maybe just quickly, I just want to share, so you can follow us on @Dig Health Rights on Twitter. I think my colleague Isla will or has already posted the link to our mailing list. We're gonna wrap up in a second. When we do, we just want to ask you to please complete the survey that you'll see when you check out. But first, just a huge thank you to the team who made this event possible: Alessia, Bettina, Ellen, Isla, Jake, Vanessa, and many others. A huge thank you to our donors, Fundación Botnar and the Open Society University Network, and above all to members of the Digital Health and Rights Project Consortium, and everyone else who gave their time to the study. As you see, we have more webinars going on here. So one coming up soon on geopolitical tensions: is global health immune or infected? Sounds pretty dark, but hope you'll join that discussion. And we look forward to keeping in touch with you through various channels, and we'll also be sharing the recording of this in the coming days. So thank you again so much for joining us, and look forward to seeing you in the future. Thank you. Bye-bye.
Thank you, everyone.
Thanks, everyone. Take care.
Thanks, everybody. And thank you, Tigist.